We had a springy block infill at 145 with pain.
Well, tight, crunchy.
Tight and crunchy. What's crunchy? Is crunchy like a Missouri, Kansas?
Love that word.
What the hell is
You know
crunchy?
what Goudy is, the crunchy
Like
has
I
the
ate those Rice Krispies this morning and they're in my shoulder. What the heck is this? Doc,
Bristle.
Doc, I got this
Bristly.
patient and they have this crunchy shoulder. What should I do?
It's when gout has the crystallization in it. It's uric acid crystals.
Myofascial adhesions, articular ligament referral pain patterns, joint fixations, capsular lesions. I want the doctor to think that I'm smart, not Rice Krispie based crunchy therapy. I'm just saying.
But that's funner.
So we didn't have any injuries, but let's get on the table. Let's go supine. So do you mind taking your shirt off for me, buddy? Can we I want to change out the new face cover here. Can we do it? Does anybody have an extra sheet?
Actually, yeah.
Do you mind if we change out the sheet just because we already got it going here? So you qualified on the temperature check to be here, good. Every time I go to the grocery store with this candy, I go, am I going to be able to buy groceries?
You passed. I did it.
You test at the grocery store where he's from.
Wow. Well, they're in Texas.
Yeah.
They reopened early and had a total nightmare. Florida too.
So this is just what we're going to all be doing this afternoon. I'm going to get my program appointment out. So I'm going to do an assessment. Actually, I'm going to just go through this real time. My goal, when he gets off this table, he has perfect range of motion. Okay. So a little bit of cryoderm on pec major. So Jan just said pec major, pec minor, biceps. That would have been the muscle pattern you would normally have gone to. However, watch. I can't stretch the subscap or the pecs tonight because there's a hard infill. So now, based on that assessment, the game plan just changed. So what I'm going to do is I'm going to relax the arm, and I'm going to do a little bit of capsule work. Maybe come up a little higher with the camera. That'd be great. Thank you. And you just took that breath, so I'm going to stretch the capsule. So you go in, you relax the capsule, you do a little rocking, and you stretch the capsule, then you reassess. Now let's just reassess. I'm just going to take his little finger, and that's a good change. We do magic tricks here. This is one of my best magic tricks ever. You know that. Okay. So now we're going to do pec major, upper fibers, inferior fibers, and a little bit of capsular lesion there. So I'm going to jump off the protocol for a minute, middle deltoid, drop the humeral head. Let's see if that changes the outcome of external rotation. That's better. Every once in a while, you got to jump off of what you think you were going to do next. Okay? Now, if I stay on the path of Yonder's work, the next one would be pec minor. Now, if it was a female, they would hold the breast tissue down. I would ask permission to touch their hand. I would ask permission to work that. But I'm just going to work from ribs 3, 4, and 5 to the corporate process. See how his shoulders way off the table? Watch this technique. When I get here, I use the scapula to drag it back. I'm using the scapula itself to drop away from the rib cage. Now, I know you need some clavicular work. So remember when we did this? You got that clavicular joint to work? And then we dropped it down here and we elevated that. What brachial plexus?
The brachial plexus.
Shut up.
That's the nerve that innervates
See, I told you.
We've got him fired up.
They're mean. They're just outright. So another way to get that clavicular motion is with the shoulder pump. You can just come in and grab it and just lift it up off the rib cage. Okay, get that unlocked in there. Get some pressure off the brachial plexus and nerves, and there's a calamus artery in here. Lots of little details. Never stretch pec minor unless you do what? Ask for renewal. No.
Never stretch pec minor till you drop the release the middle deltoid and drop the humeral.
Yeah, I knew what you meant to say. Good job. Never stretch pec minor until you release middle deltoid. And if you don't drop the humeral head, you can't treat shoulder impingement and thoracic outlet. If you don't drop the humeral head. So until you release middle deltoid and drop the humeral head, there it goes. Now here's the mistake people make when they do that technique. Very common that when they go to drop the humeral head, they're actually compressing the acromion instead of the joint capsule. If you want to drop the humeral head, you got to be off that acromion. So what I do is I release middle deltoid, I find the acromion, go lateral to it, and then I drop the humeral head under it. Is pec minor injured? It wasn't, but let's recheck. When you try to bring this arm gently back over to this hip, do you have any pain in this muscle? Okay, relax. So now we can stretch it. If I would have done that without dropping the humeral head, he would have irritated the underside of the acromion and the bursa and the supraspinatus tendon. So never stretch pec minor until you drop it. Now biceps. We'll just shoot the camera right about right now. Thanks, Brian.
She does.
He may say I
What?
Nothing. Just keep going.
I would not say that. Just me. Nothing personal.
Whatever.
Just saying. You picked like the worst spot in the whole room.
Watch it. I know, kid. I mean, kid for
Where's your thing?
Yeah.
See, she will beat me up. See?
No respect.
We're just loosening up this tissue. Now, sir, I'm going to have you slowly go sideline with the shoulder. So roll on your left side down. Scoot down just a little bit. Bend your knees. I got that. Bend these knees and hips to 90 degrees. Put your neck on the pillow. So, upper traps, middle deltoid, what the lady is looking at my head. Just seeing if you remember what I said half hour ago. If you shoot the camera from right about here. Thank you, Brian. Upper traps, middle deltoid, what are they going to do? They're going to elevate the humeral head. What are they going to affect? Supraspinatus impingement. I'll just, since y'all aren't answering the questions, I'll just answer my own. Yes, Mr. Wisłocki, they would
You
affect
did a real good
supraspinatus impingement and subacromial bursitis. I got it. I'm just making it all up as I go.
And it's that BS degree.
It is. It works every time. Got me through life.
And it runs the shoulders and gets you back your waist. You're not as blocky.
So now what? This is where, when I was in Kuwait, the physical therapist watching me, and I go like this. I go, "Do you see that hard infield?" He goes, "You got to work subscap and serratus anterior." I'm like, "Really? Or do you have a license in physical therapy?" I didn't say it. I finally had to say, "Could you just be quiet and watch?" In a nice, loving way. Because look at this. I don't care if you, what muscle you work, this motion won't change if you don't do the right thing. So if you zoom the camera over that way just a little bit, this is my favorite technique. Relax the capsule. These slides will be up here running when you guys are doing the work. Relax the patient. Now watch this hand positioning. And drop the humeral head again. So again, relax the capsule. Relax the secondary muscle guarding. And decompress the humeral head. Then what I want you to do is go back to middle deltoid. Get them to relax. There, now the humeral head. Do you feel that dropping? Right up there. Can you feel that? Now if I just take his pinky finger, and then I said to the PG, would you still work subscap? This guy needed, he was from Russia, he had a big ego, he was full of himself. I said, "No, should I still work subscap?"
And his response?
Yes. I just went, either just watch or go home. Because he could just watch or go home. I've been doing this for a few years. Just watch or go home. Okay. So let's go and just work your lats a little bit. Now, one of the things we're going to do with lats is we can do multiple things, but if it's not uncomfortable to bring your arm up above your head, is that uncomfortable even a little bit? Are you sure? It would have been. Now, when I grew up, I want to be like Eric Dalton, so watch this. This is the Eric Dalton finest. This is so filthy. Please post this. do it. So, I want Eric to see this. So, as soon as he gets ready on the camera, because I want to send this to Eric. So hey Eric, hey buddy, man, when I grew up I want to be like you, so watch this. This is the Eric Dalton move right here. You sit here, just chilling out, and then just like hanging out and just kind of doing these lats, not using any energy. So when I grow up I want to be like you, my friend. It's good. He'll get it. He'll get the point. Okay, that was fun. Let me send it to him on my.
I'll send it to you, yeah.
I'll text it to him. And he's now won't bring me Oklahoma. Okay, see all that
See,
stuff?
just didn't either.
Another thing, say they had a really bad cold and they had injured the intercostal muscles between the ribs. You can actually web in between each intercostal muscle. Deep breath. And then on the exhale, you could spring those ribs a little bit and stretch those intercostal. That's good because there'd be some, and if he broke one last year, guess what it would do? DC current right in between those rib cages. So when he coughs or he breathes deep, they can actually expand the rib. Deep breath. And just kind of rock that into those intercostals. Deep breath. I'm also getting the lats at the same time here. And then let's go slowly face down, sir. Now, scoop back up into the face cradle. Thank you. This is, I was teaching, no, I was running the camera for Paul Kelly, Eric Dalton's, I used to teach with Eric Dalton, he teaches his own stuff now. And he showed me this technique for pec minor and anterior capsular work. Your fingers are going to go under pec minor, and then what you can do is stretch towards your skin. See what I'm doing? I'm just doing this. Finger under pec minor, and then just stretch towards the ceiling. Then go to the anterior deltoid and stretch the anterior capsule, and then just drop the humeral head again. This is a cool technique. You're stretching pec minor, 1, 2. You're stretching anterior deltoid deep enough to affect the anterior capsular adhesions, 1, 2, and then you're just dropping the humeral head again. Everybody good so far?
Mm-hmm.
What am I going to do to the triceps? Lengthen them or relax and strengthen them?
Relax,
It's pretty easy.
strengthen.
Is it long or short? Is it tight or weak? Pretty easy. So all you're really getting is a little body sculpting. I'm just pushing tissue back with my I just know the big word, so it sounds like I'm smart. I'm just pushing tissue back where it belongs. So we can now he needs those erector spinae back where they can close those thoracic facet joints. Instead of doing what we learned in massage school and mobilizing a scapula, we need to stabilize that scapula. In most massages. Okay. Now, if I want to put the scapula back where it belongs, I just go like this. I lift the shoulder up, it's upward rotated, so I take it down. Now, what am I doing to the rhomboids when I pull the scapula down?
Shortening.
I'm shortening the rhomboids. What am I doing to the levator scapula?
Lengthening.
I'm actually shortening it. Because watch,
Oh.
when this is down like this is long. When I pull it back this way, I'm actually pushing it up to shorten the levator scapula, and it reduces pain at the attachments of C1 through C4. They go, wow, my neck felt better. How did my neck feel better when you were working my shoulder? It's all connected. And then just drop the humeral head like this again. Decompress, stabilize the scapula, decompress. You can come back in like this again, let's drop it nicely. Decompress. Everybody with me so far? What are we going to do to the rhomboids? We're going to stretch them. No, we're gonna, what do we do into the rhomboids when we bring the shoulders back like this?
Short.
Shortening, right? Wouldn't they feel better if they weren't constantly long? You think? So if I come back this way, I want to relax both sides. I'm just going to shorten these and put them there. Now, if I work the rhomboids, there's nothing going to go on other than myofascial work. I'm going to evaluate any stuck open thoracic facet joints with my thumbs. I can go back here and just mobilize some of those thoracic facet joints if I want. Get some blood flow going into each joint space. I can get it on both sides. What shoulder was I working on? I totally forgot.
Aren't we glad you're not a surgeon?
Why no? Because I'm glad I'm not a surgeon either. I would have written my name on his shoulder.
No.
You have my signature. So let's rule out any tendinosis in here. Now, when you push out against my resistance, any pain under here? No pain there. Okay. Let's now test the function of the rhomboids. To your comfort level, bring your arm up towards the ceiling. Your comfort level. Now that should be here. That should be here. How do I change it? What's going on with the rhomboids that's not allowing the scapula to retract? They're what? Weak and inhibited. So if I put them under a stretch, I'll get this up too. Okay. When they're under a stretch, I'm going to do some spindle cell work. They have to be under a stretch. If you don't put them under a stretch, it's impossible to wake these muscles. They have to be. So I put it under, Dalton does it behind the back. I just put the arm forward, it's still under a stretch. It doesn't matter as long as it's under a stretch. Well, you're basically saying, like the glutes, you're saying, wake up, wake the heck up, and work so that you can stabilize and retract the scapula. Let me do the mouth, buddy. There we go. So what I do is this has percussion and vibration. Let's do the plus. Same thing as spindle cell work, concussion and vibration. Feels good, doesn't it?
Get one.
Yeah, he already just put his order in. That's why I'm buffing his shoulder. So activate those erector spinae muscles. Now, one final piece before we reassess. So much freer. Feel the difference? Much freer. Humeral heads dropping. And let's now recheck your range of motion coming up towards the ceiling. Oh, that's better. Let's stand up. So you're going to get this on camera. You're good right over there. Flexion. All the way. There you go. That's a lot better. Extension. Straight back. All right. Palm forward. You should be able to go all the way to your ear. Should know. Abduction. Should be all the way up to the ear. Should know. Keep your elbow straight. There we go. That's good.
Wow.
That's good. Okay, and I think shoot from the front for the camera. Did you see this? So lateral rotation should be what? There's one last thing I want to do though. I didn't miss this in the film. This is, we should leave it till the fall. He could put some straw in here. It could be a scarecrow. It'd be really cool. I want to do something else. Middle deltoid, depending on how heavy drop there. And now let's get position release of that capsule.